Dr. Foxx, you are recognized for 4 minutes.
Thank you, Mr. Chairman. And I want to thank our panel today. The information you provide has been very enlightening. I did have an opportunity many years ago to work with a facility that worked with children who'd been sexually and physically abused. And their focus after many years became family-centered. And I learned a great deal at that time about the efficacy of family-centered therapies and family-centered treatments. So I'm really pleased to hear the comments that you all have been making about the programs that you're highlighting here. Dr. Goldsmith, I'll try to follow the example of my chairman and ask you a question. You and other witnesses have testified to the importance of using evidence interventions, and my colleagues will tell you I'm a big fan of that. In your experience, how do you most accurately measure interventions for their effectiveness?
It's a great question because lots of times people have interventions with no evidence, and there are those out there. What we do in our programs, all of the evidence-based strategies that we use, the best ones have what we call fidelity measures. And so it's like having a plan, and you want to be certain that you follow the plan. And so we have measures that we use in ours that allow us to track the integrity and how closely the intervention strategy follows the way that the model was developed. That's most important because lots of times people go to training, they get some training, and then they leave, and then they go out and attempt to implement the intervention. And if there's no ongoing strategy to know, are you doing this the way it was designed, then it doesn't happen. The second thing that we do at our organization, that we measure the impacts of our programs 6, 12, and 24 months post-discharge. So because we are looking for long-term lasting change, and what we want to be able to do is to show a funder, a representative, a parent, if you put your child and you and your family participate in this program, we can tell you what the results are based on what your presenting issues are at 6, 12, and 24 months post-discharge across the 5 main areas that impact juveniles, which would be school, association with law enforcement, mental health needs, and return back to a long-term care setting. Those are the types of things that we measure because that's what people are interested in. Basically, if you finish the program, are you in school and are you a functioning member of society like all adolescents should be? So that's how we go about doing the fidelity measures and the outcome measures.
Gentlelady yields back. Mr. Pocan.